What's going on, Wellness Gang? Welcome back to Embodied Wellness Radio, a podcast framed around making women healthy again. And today we are talking about one of my favorite things to chat about, digestive health and testing. So if you listened to last week's episode where I went through IBS and all of the different potential causes for what could be driving IBS symptoms, you'll know that there's a lot to unpack there. And one thing to know about digestive symptoms, so bloating, gas, constipation, diarrhea, alternations between the two, heartburn, and even some of the systemic issues that come along with GI issues. So those are things like headaches, joint pain, chronic fatigue, brain fog, weight gain or resistant weight loss, feeling of undigested food in your stomach, skin rashes, acne. I could go on and on. There's many different things that could be driving this. And I've actually done a whole podcast episode talking about what digestion really is and the process of it. And so if you go back and listen to that, you'll know that there's a lot going on there. There's a lot of things that need to happen, from food being on your plate to you pooping it out, and all of that in between stuff that could go awry is a lot. There's so many different things that could be driving these symptoms. And so this is why, especially when we're looking at digestive health, testing is so important. This is, again, something that I have changed my mind on, actually, since starting practice. And the more that we know, the better that we can do. So when I first started practicing and I was getting into some more of the functional stuff in digestive health, I would run a lot of SIBO breath tests, because SIBO, and if you don't know what that is small intestinal bacterial overgrowth. And I'll get a little bit more into that in a second. When I first started, I knew how prevalent it was, and I saw so many people come back with positive SIBO breath tests. And I was like, yeah, I'm helping so many people. This is awesome. We have a way to understand what's causing this person's issues. This is great. But when I started learning more about just how intricate the digestive system is and all of these other factors, I was like, oh, this test, or like SIBO specifically, is still a symptom. SIBO is not a root cause. And there is so much missing when we're only running, a lactulose breath test to see whether or not the person has overgrowth in their small intestine. And all of that other stuff that's missing is leaving so many healing opportunities for the people. So I have changed my mind on how often I run these. I now actually very rarely run SIBO breath tests in my practice. I use something called a GI-Map, which is a stool test, alongside often things like blood test markers run through a doctor, to help women on their digestive healing journey. And I have found it to be so incredibly beneficial, like so helpful. And the rate that I see people get better, not only get better, but also stay better, is truly just beautiful and remarkable. So I'm very, very happy to have this discussion today. And again, testing for your gut health is so important if you have issues going on, because there could be many different causes of your symptoms. And if you're just going based on assumption, or, spending money on all these supplements, you're probably going to end up feeling really frustrated that you're investing all this time and money to get better, and it's just not getting you to where you want to be. Okay, so what is SIBO? And when I'm talking about why I no longer run this test, it's important to know what we're actually talking about. So SIBO, aka small intestinal bacterial overgrowth, is, as the name suggests, an overgrowth of bacteria in the small intestine. And this can happen due to lots of different reasons. So it could be a history of antibiotic use. It could be chronic dieting or low diversity in the diet. So this would be maybe somebody who does, let's say, a bodybuilding show, and they're only eating the same 5 foods for months and months on end. This can also happen due to things like poor bile flow, poor liver health, even hypothyroidism, traumatic brain injury, poor eating habits, medication, just to name a few of the things that could cause or influence somebody getting this bacterial overgrowth. But typically, it's not just one thing. It's usually a combination of different things that leads people to these imbalances and to these dysregulations. So it is important, again, if you listen to the last episode, to do a proper intake and understanding all of the ways that different lifestyle, dietary, medication even, and all of these different stressors have on the person and what led that person to get to where they are. So if you do have SIBO, or if you have had SIBO, what are some of the common symptoms? So typically one of the most common ones is bloating that progresses throughout the day. So some women will wake up already having a morning bloat, and as they eat throughout the day, the bloating gets worse and worse. And you'll often hear people say like, I look like I'm 6 months pregnant. I look like I'm 7 months pregnant. And it typically is a very visible distension that's also quite hard. These clients can also have a lot of gas, so that could either be flatulence or burping. Typically, they'll experience changes to bowel movements, but not always, so constipation or diarrhea. And I always feel like I need to, or I don't do this enough, discuss what that actually means. Because I say constipation and I'll have clients who are like, oh, I'm not constipated. But then when they report about their stools, they're having type 1 stools pretty much every day. And I'm like, baby, you are constipated. So if you were to look up something called the Bristol stool chart, you would see that there is different types of stools you can have. So ideally, we want to be having these type 4 stools, which are long and look like sausages, and that is a healthy stool. If somebody's having these dry, hard, pebbly stools, you're still constipated. If you are not having 1 to 3 good quality, feel good, make you feel incredible after bowel movements a day, you're constipated. And diarrhea would be more watery. It doesn't have to be like full on, type 6, 7. It could also be more so like a type 5 or bowel movements that feel like you have to wipe a lot to clean them up. So there is a sliding scale. And sometimes when we talk about constipation and diarrhea, it's not always like super obvious or in your face. So it is important to discuss what that means. Now, people who have SIBO also will experience systemic symptoms a lot of the time. So joint pain is really common. Fatigue is really common, headaches. When we run blood tests, again, I mentioned I always like to use that in conjunction with testing. You'll also see nutrient deficiencies, so low iron, low B12. These are very common for those with SIBO, and even autoimmunity. So small intestinal health is so important for our overall health. 90 to 95% of the calories or of caloric absorption, the way that we absorb nutrients and calories, happens in the small intestine. And it also includes the largest concentration or a mass of immune cells. So important for our immune health. And I often see people who have dysbiosis or SIBO with autoimmune conditions as well. So this can actually be an influential factor in those. And especially when they're in flare-ups, you'll often see gut-based issues come along with that as well. So again, it is really, really common to see somebody have SIBO or dysbiosis, and sometimes, very rarely, the person can actually be asymptomatic, so not having many symptoms. Now, part of that could be just the way that, their body is. Some people are more resilient than others, but a lot of the time they might feel asymptomatic because they have become accustomed to feeling a certain way. So they might not rate themselves as bloated because they haven't felt what it's like to not be bloated in forever. Again, they might not rate themselves as constipated because they think having a bowel movement once every 2 days is normal. So we also, again, have to open up the discussion and ask proper questions of like, do you feel X, Y, and Z? How often are you having bowel movements? And this is really important to discuss with patients if you are a practitioner listening to this, to actually understand the client's symptoms better and to give them a little bit more description on what is normal and what isn't. So when I was running these SIBO tests, there's a few different ways that you can do SIBO breath testing. I would always use a lactulose test. So this is where they drink a drink and then they blow into these little tubes every 20 minutes for 3 hours. And essentially what the test is testing is production of gas. So with SIBO, there's certain types of bacteria that are going to produce either methane, hydrogen, or hydrogen sulfide gas. And this can be measured in the breath after drinking the drink, which essentially feeds the bacteria. And when I was running these tests, I saw a lot of great client success, right? Like it wasn't like I wasn't being able to help people with these tests or my clients were succeeding. In fact, like I actually saw great client success, but there was still a missing piece. And more so the reason why I switched is because I started to get a lot of clients who had come to me after working with naturopaths or other practitioners, and they've been trying to heal their SIBO for years. Like, oh, I've done, 20 rounds of antimicrobials, or I've been having relapses off and on for 10 years. And I'm like, what the heck is going on here, right? Like, if we think about it, yes, the digestive system is so complex, but really, why am I seeing such a high percentage of people who are continuously relapsing or haven't seen a huge reduction in their symptoms despite doing like every treatment available to mankind and some available to sharks even, I swear. What is the missing piece? So that is why, again, I got into this further testing, but there is still so much success to be seen in the tests that I have run with these clients and the success rate there. So let's take a look through what a SIBO breath test looks like. So if you're watching this on YouTube, you're going to be able to see this on the screen. If you are listening, you can go check it out later, but I'm also just going to talk you through some of the metrics, and then you can maybe take a look at it later, or you'll still be able to follow along even without looking at it. So this I have redacted from a client, so there's no personal information here. And you'll see here on the left side, again, every SIBO breath test or different like brands or depending what lab you use is going to look a little bit different. So this one is run through SIBO Clinic Canada. And again, it's a lactulose breath test. So you can see here on the side, this specific client was experiencing nausea, bloating, constipation, gassy, acne and rashes, halitosis, which is bad breath, fatigue, dizziness, abdominal pain, and a note here that this client is chronically stressed. So we can see here on her breath test that this is SIBO positive. So it essentially looks like a graph and there's 3 different lines, and these are showing types of gases. So this specific test is not testing hydrogen sulfide, and we're not going to go down that rabbit hole, but hydrogen sulfide is relatively new in the understanding of SIBO, and it is a different type of testing. Again, not going to get into that, but this test specifically is looking at hydrogen gas, methane gas, and then we see one line, which is the green line if you're looking at the screen, for combination of hydrogen and methane. And different strains of bacteria produce different gases. So a category of bacteria called methanogens, those are going to produce the methane gas, and then we have different strains of bacteria that produce hydrogen gas. So when I was treating SIBO breath test, this would guide our treatment because you can use different herbs for methanogens and different herbs for the bacteria that are causing the hydrogen gas. And when we are discussing with patients or clients the how long their treatment might take, it's important to know, like with what round of treatment, we would expect an X percentage decrease in this specific type of gas. Methanogens are a little bit harder to get rid of, but again, this just helps to guide our treatment. So it is important to look at proper testing for these issues. So you'll see here that this client does have high elevations, and pretty much across the board, she has elevations in hydrogen, which is this blue one here. She has elevations in methane, which is this orange bar. And then her combination bar is also off the chart, pun intended. And you'll see here at the little box below that it's just showing what hers was in relation to what would be considered quote unquote normal, and that she has a lot of check marks because they were pretty much all elevated at every single sample. And the sample numbers are just showing like this was after 20 minutes, after 40 minutes, and the number that specific sample was. So because these are elevated, again, this is SIBO positive for both hydrogen and methane dominant SIBO. If this was SIBO negative, we would expect to see a flat line. So that would be no gas production. So you can see here we do have a lot to work with. So we would see something like this. This client is constipated. So we would do a proper prep phase, meaning I'm going to prepare this client to get rid of bacteria, especially because she's constipated. If I was just to go in and start killing off a bunch of bugs, where the hell are they going to go? We need to make sure that her drainage and detox pathways are open properly so that when we started to treat the SIBO, she would actually be able to clear it out of her body and not have things like lipopolysaccharides or endotoxins floating around in her bloodstream or causing her to have a lot of die-off reactions as well. So again, we would go through treatment, which would look like a prep phase. Then you move into what we would consider like eradication or killing off the bacteria. So that could involve dietary changes as well as either taking herbal antimicrobials, which I use in my practice, or you could take antibiotics or something called an elemental diet, or sometimes there'll be a combination of those. So then you would kill off the bacteria and then you would move into like a gut rebuilding protocol essentially. So this is great, right? We have a lot to work on. Cool. The person tested positive for SIBO. We know what's driving all their symptoms listed over here on the left. We can treat it. Great. But what if the person had SIBO plus a parasite? What if the person had SIBO, but we also see they have low secretory IgA? What if the person had SIBO, but also elevations of Candida? So we've treated what came up on this test, but we haven't treated all the other stuff. And this is where this test alone can be very problematic because SIBO is not a root cause, it's a symptom, and even some of the other infections can also be symptoms. So many people, again, as I mentioned, I saw this all the time with clients who started with me. They've gone through SIBO treatments and maybe they get better and it comes back. Or maybe they go through, herbal antimicrobials, antibiotics. They do rounds and rounds of these and they still don't see a full reduction in symptoms. They might feel a little bit better, but not fully, because you could be getting rid of this, but not all the other stuff. Or you could be killing off the bacteria, but you haven't looked at why there's this dysbiosis or this bacterial overgrowth. You haven't addressed things like poor bile flow, low stomach acid. And so while you're clearing this, it's kind of just like circling and spiraling and you're running on this hamster wheel. So yes, this can be great and it gives us something to work on, but I would argue it's not enough. And so that's why I moved away from just running these breath tests. I can't even remember the last time I ordered a SIBO breath test. Again, there might be some cases where it could be beneficial. Never say never, especially when it comes to health. There is no black and white, but this is why I moved from doing just this to a more comprehensive stool analysis that gives us way more context to not only different infections or different dysregulations that could be driving symptoms, but also some of those factors as to why this could be the case. Okay, so let's get into the test that I do run now. So the test that I personally run is a stool analysis, and it is from the laboratory called Diagnostic Solutions, and it's called a GI-Map. So essentially how this one works, if you remember the last one, you were blown into a little tube every 20 minutes for 3 hours, and you have to do a specific diet before the SIBO test. This is a stool test, so you're essentially going to poop into the toilet. It's really fun, really exciting. If you've ever done one of these, you're like, oh my gosh, I probably have PTSD from even listening to her talk about it. You put on these little gloves, you pull your poop out of the toilet, you put it on this little thing that looks like the container that they give you hot dogs in, and you scrape off parts of it, you put it in a tube, shake it, and then you send it off to the lab. So then you'll get back this, which is an example of a test, and it says patient here is Brad. When I was doing my FDN certification, this is one of the samples we were given, so it's not actually a client. They've redacted all the personal information. And I always just have to say that as a disclaimer, I'm not sharing with you guys somebody's information, so you can go look them up and be like, hey, I saw that your poop is all effed up. So let's get into it. So on the first page, we have pathogens. So these are things that if these actually came back as positive, so Salmonella, E. coli, C. diff, Giardia, these would be things that legally and ethically, I have to involve a doctor in the discussion. Some of them can potentially be life-threatening or quite serious. So if anything came back positive on this page, I would refer the person out to their doctor or at least involve them in the discussion. In running probably hundreds of these by now, I would say E. coli is actually pretty common. C. diff is quite common, and I have seen Salmonella in some cases. Giardia sometimes as well. So your doctor could treat this sometimes they'll say it should just be transient, as in it'll pass through. Sometimes they will give you an antibiotic, but really the first page is kind of more alarm or red zone where you would want to treat it right away and involve a doctor in that discussion. The second and third page. So this is where we really get into the good stuff. And this gives so much context to why people might be having digestive symptoms. So again, bloating, constipation, gas, heartburn, fatigue, feeling of fullness in your stomach, weight gain or resistant weight loss, joint pain, headaches, that whole shebang. So first we see here H. pylori. Now, H. pylori can be run through your doctor. However, the testing that they do is not super sensitive. So I have seen a lot of H. pylori come back positive on a GI-Map and the person be symptomatic, but they've done maybe a test through in Canada and BC. We have something called Life Labs where people would go to get testing and it's come back negative. So H. pylori is actually a natural inhabitant of our digestive system. Having a little bit can be helpful, but having too much is not great. So those with H. pylori infections typically have a burning sensation in their stomach, almost like it feels like it's gnawing, heartburn. H. pylori is actually the leading cause of stomach ulcers. And then anything like bad breath, burping is really common, and bloating, constipation, diarrhea, those can be for any of these. So what I like about this test is it not only shows whether the person has or doesn't have H. pylori, but also virulence factors. So different virulence factors are going to put the person at higher risk for certain things. So for example, some of them would put the person at higher risk for something like stomach cancer. So we would want to be very mindful of that and potentially be doing a lot of retesting for this individual and make sure that we really have eradicated the issue. So H. pylori, again, not shown on a SIBO breath test, very, very common when I run these and can drive a lot of symptoms. So if the person, we ran maybe a SIBO breath test, it came back positive, treated the SIBO, maybe got rid of it completely, but didn't treat H. pylori, which uses different herbs and treatments, they're still not going to feel great. And so they might feel like my SIBO treatment was failed, or they have recurrent SIBO, or my SIBO hasn't gone away, when in fact, it's actually a different infection. So down here we have normal bacterial flora. So what the heck does that mean? This is our healthy gut bacteria. So we do want healthy gut bacteria. You know, have heard, if you're anywhere on Instagram or anywhere listening to podcasts, you've heard people talk about the importance of our gut microbiome and how it's so important for things like brain health, mood, even hormonal health, digesting our food, nutrient absorption, nutrient production. So very, very important we have enough healthy bacteria. Now, you could have too little healthy bacteria, so not enough. This specific case example is high. The next one I show you will be low. And that's going to cause a lot of similar symptoms to SIBO, because we don't have enough good bacteria to break down our food. So when we start eating these foods and these carbohydrates and these specific types of fibers, we can't break them down, so they're getting essentially stuck or undigested in our stomach, leading to indigestion, bloating, gas, constipation, diarrhea, the whole shebang. So too much is not good. This specific case example, if you're looking on the YouTube, is a case of just elevations everywhere, inflammatory dysbiosis. So this person has too much good bacteria and too much bad bacteria. Whereas you could have too much bad bacteria, not enough good guys. You could have not enough good guys and no elevations in bad guys. So again, this gives us way more context than just a SIBO breath test. Now, if somebody was SIBO positive, what we're going to see here to be pretty much the same is elevations of bad guys. So SIBO breath test, again, is small intestine. This, because it is a stool test, is looking more at your large intestine. But the way that you treat large intestine bacterial overgrowth and the way that you treat small intestinal bacterial overgrowth, pretty similar. What changes is based on everything else we see on this stool test, what else we're doing for the person's treatment, and different steps you might have to take along the way in the protocol, and different considerations to make. So for example, in a person who has low healthy bacteria, but elevations of bad bacteria or SIBO, we need to consider this a little bit differently than this guy, Brad, who has high levels of good bacteria and high levels of bad bacteria. So again, this section here is really what a SIBO breath test is showing. Different, again, large intestine versus small intestine, but to make it super simple, all we're getting on a SIBO breath test is this section here of, is there elevations of bad bacteria? So again, this test shows good guys, bad guys. Without getting too much into it, when we're looking at our healthy gut bacteria, different strains also have different connections or functions in the body. So let's take this guy here, Akkermansia. Akkermansia has been well studied in relation to metabolic health and obesity. So there's been lots of studies that show those who are obese or have metabolic issues, can't lose weight, resistant weight loss, have low levels of Akkermansia. In running a lot of these tests, not funny enough, but I see Akkermansia come back as below the detectable limit. So this here where it says DL, in so many cases, more so than any other strain of bacteria. So some of these do relate to things like metabolism and weight. We also have some that are important in vaginal health. So you might see low levels of something like lactobacilli or bifidobacteria, which are important in our vaginal health and flora. So this is important for somebody who maybe has chronic yeast infections. We also see here something called phyla-microbiota. So if you remember back to biology, and I'm pretty sure like middle school or high school, we learned about phyla and species. So phyla is a little bit of a bigger group, and the species like Akkermansia, bifidobacteria fall underneath the phyla. So we're looking at Bacteroidetes and Firmicutes and ratios of the two. Again, this is really important when we're looking at things like metabolic health or somebody's inability to lose weight. We can also see these be really important for just somebody's ability to digest certain foods or carb metabolism. So we do get a lot of great information in looking at the balance of certain strains, specifically relative to the person whose test this is and the symptoms that they're experiencing. So really, really love this. I think the healthy bacteria section is so cool to look at and to be able to relate it to people's symptoms of hey, this thing that you checked off on your onboarding form, here we have an answer for that. And it's pretty cool because you can also use dietary strategies and nutritional therapies to help to boost a lot of these, which can be really helpful for the person. Again, here we have dysbiotic bacteria, which I talked about. What's interesting about this test is there's a different section for bacteria that are specifically related to autoimmunity. So whenever I see clients who have multiple autoimmune conditions, all of these come back elevated, 99% of the time. And when we work on eradicating these or getting rid of them, clients see such a reduction in their autoimmune symptoms. And a lot of the times they even go into remission from eradicating these bacteria that are partially driving it. So really, really cool. Great stuff that we're able to see here, not just for digestive health, but for so many other things. And as you can tell, I love this stuff. It's, again, just so valuable. Okay, so next we have fungi and yeast. Candida, I feel like Candida was such a big buzz. Almost every client I'd seen who had bloating for a little while and went to a naturopath was oh, I was on a Candida protocol. I feel like it used to be all the rage before SIBO became a thing. It was super trendy for people to do Candida cleanses or protocols. I would say that with this test, again, it's a stool test, which means it needs to be what they're seeing here needs to be coming out in the poop. Candida is not, or doing a stool test for Candida is not the best because it is a yeast. It's going to grow and it's going to create things like biofilms and live with bacteria. So people aren't always able to actually poop it out because they're not necessarily getting rid of it. It's more so stuck essentially in their intestines. So even if I see somebody come back as Candida negative, a lot of the same herbs that you use to treat bacterial overgrowth are also going to be antifungals. So they're going to help with yeast overgrowth. So they're going to help at the same time. But if a person does have elevated Candida on this test, they probably have really high Candida because, again, a stool test is not necessarily the best test, just being completely transparent for Candida, just because of the way it lives and interacts and molds itself, if you will, into the body. So again, here on the second and third page, we have H. pylori, normal bacterial flora, opportunistic bacteria or dysbiotic bacteria, and fungi and yeast as well. So lots of good stuff to look at here. And again, we're able to see just so many other things that could be driving somebody's symptoms outside of just SIBO. And if these things are left unaddressed, but SIBO is cleared, the person is still not going to be feeling very great. So at the very bottom, we have viruses. So we see Epstein-Barr virus, which is actually indicated in a lot of autoimmune cases. And these are things that are important to address and to understand in the way that they affect the digestive system. I'm not going to go down that rabbit hole right now because, as you guys know, if I start going down there, it's going to be a very long podcast. So we just want to, we're just going to note that it does also show viral infections here. Okay, next page. We have parasites and worms. I would say parasites and worms are pretty common. There is a lot of different parasites, 200 or 300 parasites that we know of, and this is only showing a few. So sometimes people will again test negative for parasites, but they could still have parasitic infection. However, these are some of the more common ones. And again, this is why it's important to also do proper symptom testing for people and to have them report on different symptoms and to understand how to maybe look for these outside of just the stool test. But parasites on this specific tests are also very common to come up. And parasites also like to co-infect with bacteria, same with H. pylori. So I do often see people who have H. pylori, dysbiosis, or SIBO and parasites all at the same time, which is super fun. And we would need to do a targeted protocol that doesn't try to kill everything at once and overwhelm the person. We would need to go through different phases in order to treat that. And again, like SIBO or the dysbiosis only being one small portion of this. Next, we see worms. I wouldn't say it's super common that I see worms come up, but that could be another driver of symptoms. And we are on to arguably one of my favorite parts of this test, which is intestinal health markers. So these are things that are not just looking at infections or pathogens, but rather how the person's intestines are functioning or other things that are really important to consider for healing. So first we have steatocrit, which is looking at the person's ability to break down fat. So let's say that the person had elevations of steatocrit. This could mean that they have poor fat breakdown. So then I'm also thinking, and again, correlating with somebody's blood work, do they have poor bile flow? Do they have gallbladder issues? Do they have issues with liver health and the hepatic portal system? Like there's so many different reasons why somebody could be having poor fat breakdown. And this could give us further insight into maybe why the person got SIBO in the first place and give us another opportunity to heal the root cause so that if we clear their SIBO or dysbiosis or we work on what came up on the GI map, they're not going to get the same stuff happening again. So really great to look at. We also have elastase. So this is a pancreatic enzyme. I often see this come back as low. The first time I ran my GI map, this was also low. And it's a really important digestive enzyme for breaking down food. So if we're not able to break down food, we're going to have food sitting in our intestines. It's going to ferment and lead to bacterial overgrowth. So low elastase could be a root cause or one of the influential factors in somebody having something like SIBO. Again, if we clear the bacteria, but we don't address this, person's still going to be having problems. There's also a study that was done that came out that said up to 70% of IBS cases, and if you listen to last week's episode, you'll know that that could also be like SIBO or anything that comes up on this test, was due to low elastase or had low elastase as one of the co-infections or something that could have caused it. So really important to look at this as well. And we can bring this up again through supplementation and some different changes that can really help to support it. Next, we see GI markers. So this one here, beta-glucuronidase, is actually an enzyme that's very closely related to estrogen. So I typically will see this come back as high in women who have painful, heavy periods, a lot of the times endometriosis and PMS type issues or any gynecological condition. The reason being is this specific enzyme, beta-glucuronidase, takes estrogen that's ready to leave the body in a form that our body can excrete. So essentially estrogen's like tied up in this nice little Christmas present, and this enzyme unties it and kicks that metabolite back into circulation in a more potent and harmful form. So people who have elevations here are going to experience more high estrogen symptoms and potentially even if their testing comes back as them having normal estrogen. So really, again, this just gives us so much great insight, not only into gut-based issues, but into other symptoms that clients might be experiencing as well. Occult blood. This is something that if it did come back as elevated could be a marker of something like IBD. So I would send clients to their doctor to get a referral to a gastroenterologist, to get a colonoscopy and endoscopy to rule out things like Crohn's and colitis. And then we have immune response. So again, I mentioned that our small intestine has the largest mass of immune cells. Our gut is so important for immunity. We have something, this marker you'll see here on the screen called secretory IgA, which is our body's most prevalent immunoglobulin. And this is really involved in immunity, but also we see this for symptom or to relate it to symptoms a lot with food sensitivities. Now, those who have autoimmunity, I often see this as high. Sometimes I'll see it as very low for those who might be taking something like an immune suppressant. It can also become high due to the person eating something they're sensitive to. It can become high due to cortisol dysregulations, but typically a person who has high SIGA is somebody who's very reactive to foods and they feel like they eat a lot of things and their body's always reacting, or their immune system is like hyperactive and they're just super sensitive people in general. Low secretory IgA, on the other hand, these people can also have food sensitivities because we don't have this immunoglobulin to essentially tell our body what's safe, what's food, and what's unsafe, or what needs to be attacked, essentially. The other thing to note about secretory IgA is it's also produced in our intestinal lining in the mucosa. And so those who have intestinal permeability will also see dysregulations to secretory IgA. So if I see this as low on somebody, then we're also going to make sure that we need to support intestinal permeability, which I do in pretty much every gut protocol, but especially for that person, that's going to be very important to work on, because if we, again, clear the infections, but we don't heal and reseal the gut lining, the person is still going to be problematic and have a lot of symptoms still prevalent. So secretory IgA, again, this would also link to immune-based issues. So this person might be histamine intolerant. They might eat foods and feel like their eyes get really watery or they get super itchy. They might experience a lot of allergies, seasonal allergies or food allergies, autoimmunity. Again, like this is, I could do a whole podcast just on SIGA. I think I should do a gut marker podcast, but very, very important and very valuable. Antigliadin is a marker for gluten sensitivity, so not the same as somebody who's celiac, but it is showing if somebody is sensitive to gluten, which is important for doing a protocol and making sure that we're not eating foods that our body's reactive to or going to make us more inflamed and further cause digestive distress. And then we see calprotectin. So this is a marker of inflammation. This is something that's also run by doctors. So you might, if you have had gut-based issues or chronic GI issues, if you've been lucky, your doctor might have run this. And again, this is just telling us that your gut is inflamed. It's not necessarily saying where the inflammation's coming from, but in this case example, it's kind of clear where the inflammation is coming from. We have so much going on here. And then on the last page, we have antibiotic resistant genes and phenotypes. So let's say the person came back as H. pylori positive, and I open up the discussion with the client of like, hey, depending on how symptomatic they are, depending on, again, things like finances, you have the option to either go to your doctor and ask them to treat this with something like an antibiotic. The duration will be shorter, potentially could be covered under MSP, or we could treat this a natural way or through the natural route. So if they were to choose antibiotics, we would need to know if they have any resistance to antibiotics, right? So if somebody came back as antibiotic resistance to amoxicillin, that's not the best antibiotic that's going to treat their H. pylori. So again, this is just more information for the treatment of the person. But going back to why I no longer run SIBO breath tests, as you can tell, this test is way more in depth. It not only gives us whether or not the person has bacterial overgrowth, but it shows other infections like H. pylori and parasites. It shows some intestinal health markers to potentially why the person could have gotten this in the first place and other things that are important to address in a healing protocol. It shows maybe things like low levels of healthy bacteria that would prime the person to have an ecosystem in their stomach that's more prone to having bacterial overgrowth. So way more information we get on this test. And again, just to go back to relating this to, as a practitioner, the difference this can make for clients is I've seen clients who have run so many SIBO healing protocols or they have recurrent SIBO and they're not getting better. And we run this test and we're like, well, here's why you're not getting better. There's all these other infections going on that haven't been addressed. So yeah, you have SIBO, but you also have H. pylori and a parasite, and you have low elastase, and you have dysregulations to steatocrit, and you have no secretory IgA. So we've got a lot to work on. And again, SIBO is only one small part of that. And so you could, again, clear your SIBO and still be symptomatic, and this is one reason why. I want to talk to you about another case. So this kind of stems off of that. So this case, or this GI-Map, is actually from a client who I'd seen who had been treating SIBO off and on for about 10 years, and they had gone through a naturopath, they had done antibiotics, they had done antimicrobials, and she came to me because she's like, Sarah, I'm sick of having SIBO. Like, there's no reason why I should be dealing with this shit for 10 years, and I can't get better. Like, what's going on? And so we kind of did a little discussion of like what her symptoms are. I did the onboarding process. And I'm like, you know what? I think we should run a GI-Map. I don't want to just start treating your SIBO again. Like there were a few things where she didn't do a proper prep protocol. And there were some things missing to her treatment plans before where I'm like, yeah, these things could have made a difference. But I would love to run this test, and just because you've been dealing with these issues for so long and you haven't really done any sort of testing in years, it's not appropriate for us to just assume you have SIBO and start treating it again as if it was. So we ran this test, and lo and behold, if you are looking on the screen, there is no dysbiotic bacteria that's marked as flag. Yes, we see some present here, so not all of it is below the detectable limit. It's still present. However, the main issue here is if we look over here at commensal and keystone bacteria, this test was actually run at a different time, which is why it looks like a tiny bit different, but these are the healthy guys. Low, 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 low. Low strains of different ones, different specific strains, as well as phyla. So the larger groups, both of them are low. So this is actually not a case of SIBO. This is somebody who has been taking so many antibiotic and antimicrobial rounds that she's actually pushed herself in the other direction and doesn't have bacterial overgrowth. She has not enough healthy bacteria due to the fact that she's been assuming her symptoms that she's experiencing, so like bloating, hers were loose stools, and a lot of food sensitivities. She's been assuming they were due to SIBO, continuously treating it, and now she doesn't have enough good bacteria because she's killed them all off. So I was so happy that we ran this test. If we go back to the intestinal health markers here, we'll also see that she has low elastase. So again, this is something that wasn't addressed previously and probably was one of the, I'm not going to get too much into her case of like why she had it, but essentially it was like chronic stress, over exercise, and probably now low digestive health markers, low elastase, and low secretory IgA that are also contributing to her SIBO or contributed to it and her symptoms. So with her, we didn't do another round of antimicrobials. We didn't try to clear her SIBO again. We actually worked on a gut refortification protocol where we're now bringing up levels of healthy bacteria. We're addressing intestinal permeability. We're dealing with her chronic stress and over-exercising. We're bringing up her pancreatic elastase. And we were able to get her to a point where she's now asymptomatic. She's able to eat all the food she hasn't been able to eat for years with no symptoms at all. And she is finally at a place where her digestive system is healed and she has no symptoms day to day. She can eat whatever she wants. And it's just again goes to show, like, we can't just assume that if you have had chronic SIBO or recurring SIBO, it's not good to just continue treating it without looking at the fact that might not be what's driving your symptoms anymore. And in this specific case, a lot of the lifestyle stuff was one of the biggest needle movers too. So yes, we did work on a gut refortification protocol. And at the same time, it was truly the lifestyle stuff that not only helped her to get better, but has helped her to stay better for, when was this test run? Does it have a date? I believe it's been just over a year since we ran this test. So the protocol lasted for about 3 months, maybe just a little bit longer than that, to where she was at a place where she was asymptomatic. And now a year later, I just touched base with her. She still has no symptoms. She has lived symptom-free for pretty much a year now and was so happy that we did this test. And we were kind of just laughing at the fact that she treated SIBO for so long when that wasn't actually what was going on. So again, going back to the original question or the title of this podcast, why I rarely run SIBO breath tests in my practice anymore, they're not enough. So somebody could have SIBO with a lot of other infections. You could completely clear the SIBO. They're still not going to feel better. SIBO breath test alone also doesn't say why the person got it or give us other insight into markers that might need to be brought up in order to help them prevent relapse. And it's only one small snippet into the huge ecosystem or the huge, essentially symphony that needs to play in order for your digestive system to work well. So yes, if you do have GI issues, testing is so important, but the correct testing is also really important. And something like a SIBO breath test, for some people can be really valuable. And I did see it work really well in helping patients feel better, helping patients to minimize and mitigate their symptoms. But now that I know better and I've been able to do better, I rarely run those tests anymore because there is way better testing that will give you much further insight into your symptoms. And I've just seen this really be so powerful in women completely healing issues they've had for, honestly, in a lot of cases, decades. So this was a little bit of a longer podcast. I really wanted to break down what this test is and show it to you. I will also say that something like this or this specific GI map is a bigger financial investment than a SIBO breath test. So that could be a downside for people. And I always open up discussion with clients on what testing would cost, what I think is right for them, and we come up with a plan that's going to work for them, what they have going on in their body, and also consider things like finances because especially in today's economy, that is important. But this test is incredibly valuable. And I hope that you got a lot of value out of this podcast as well, especially if you've been dealing with chronic symptoms, or maybe you've had SIBO and you haven't felt like you've been able to clear it, or you've had gut-based issues going on and you're just unsure where to start, or you haven't been given much support, or going back to last week's episode, you were given the diagnosis of IBS with no further support than that. This can be incredibly valuable. If you are interested in getting this test run through me as a practitioner and you're listening to this podcast, head over to my website, embodiedwellnessco.com. I have lots of videos explaining different ways that we can work together. Every single coaching option is explained in detail, and I do offer this testing for clients alongside customized one-on-one support where I'm going to look at all the different factors in your body. So lifestyle, history, things like antibiotic use, as well as symptoms. We might also do things with your doctor like blood work so that I can integrate the two together. So really taking this integrative approach to your health, completely individualized. I take each client case as if I was just starting from scratch to really understand you and your symptoms. Again, head over to my website if that sounds like something you're interested in. There is a coaching application there that you can fill out for us to work together. And if you have any questions, you can feel free to reach out to me either online through the website or on social media at Sarah Collins Wellness. Thank you all so much for tuning into today's episode. I loved chatting about this, and I'm so stoked to continue to bring you all things health and female wellness in 2024. Chat soon.